Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is August 22nd, 2025. This video is on a JAMA article published on August 11, 2025, titled Prostatitis, a Review. Understanding prostatitis. What is prostatitis? It refers to inflammation, infection, or pain in the prostate gland. It includes 4 NIH-defined types. How common is it? Approximately 9.3% of men experience prostatitis during their lifetime. How are the types different? Types 1 to 3 have pain, urinary symptoms, but differ in cause. Type 4 is asymptomatic. How is symptom severity measured? With the NIH-CPSI score, that is chronic prostatitis symptom index score of 0 to 43, a 6-point change is clinically meaningful. Do all types need therapy? Only types 1 to 3. Type 4 is incidental and needs no intervention. Acute bacterial prostatitis, type 1. What causes acute bacterial prostatitis? Primarily gram-negative bacteria like E. coli, often post-urinary instrumentation. What are the typical symptoms? Fever, chills, pelvic pain, urinary urgency and frequency, and retention. First-line therapy? Broad-spectrum IV or oral antibiotics for 2 to 4 weeks. When to hospitalize? If sepsis, poor oral intake, post-biopsy, or unresponsive to oral antibiotics. Is PSA useful? No, it's not recommended during acute infection. Chronic bacterial prostatitis or type 2. How does chronic prostatitis present? With recurrent UTIs, with the same strain, pelvic pain, or lower urinary tract symptoms. Common pathogens, mostly gram-negative bacteria, especially E. coli, 66%. Preferred diagnostic test? 4-glass or 2-glass test showing 10 times the growth in VB3, that is post-massage, or VB2, pre-massage sample. Recommended treatment, fluoroquinolones for over 4 weeks. Alternatives include trimethoprim sulfa combination, that is Bactrim, and doxycycline. Why hard to treat? Biofilms and fibrosis reduce antibiotic penetration. Type 3 is chronic prostatitis or chronic pelvic pain syndrome, that is pain more than 3 months without infection or obstruction, often with lower urinary tract symptoms. Is inflammation always present? No, only 33% show histologic inflammation. Associated comorbidities, IBS, irritable bowel syndrome, fibromyalgia, chronic fatigue, depression, and anxiety. First-line therapy, alpha blockers like tamsulosin or alfuzosin. Are antibiotics useful? Not routinely, only if culture positive. Alternative and supportive therapies. Are NSAIDs useful? Small benefit. The change is from NIH-CPSI score from minus 2.5 to minus 1.7, below the clinical threshold. Pregabalin's role, modestly improves symptoms and quality of life. Effectiveness of phytotherapy, quercetin or pollen extract shows small benefit, but regulatory concerns exist. Is pentosan polysulfate effective? Some benefit may cause vision toxicity. Pelvic floor therapy's role, helpful for pelvic floor myalgia, common in chronic prostatitis or chronic prostatic pelvic syndrome. This is in a nutshell on this review. For those interested in the diagnostic specimens VB1, VB2, VB3, and expressed prostatic secretions, hit pause and watch this segment. The diagnostic criterion is 10x the bacterial count in expressed prostatic secretions, or VB3 compared to VB2 is equivalent to chronic bacterial prostatitis. Eponyms in prostatitis: the Meares-Stamey test, the 4-glass test, developed by Meares and Stamey in 1968, localized bacterial infection to the prostate using BB1, BB2, EPS, and BB3. The NIH Chronic Prostatitis Symptom Index. It's a standardized 13-item tool from the NIH. Evaluates pain, urinary symptoms, and quality of life in chronic prostatitis or chronic pelvic prostatitis syndrome. Stamey conducted pioneering work in antibiotic penetration into prostatic fluid, shaped modern treatment of chronic bacterial prostatitis. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.